Okay, let's go ahead and get started. First of all, welcome to our first virtual Science on Tap. I'm Shawn Plew. I'm a 2004 computer science graduate, and I'm the president of the School of Science Alumni Board. Before we start, I'd like to raise my glass, my fancy IUPUI School of Science class. Thank you, Betsy, for coming over at a properly social distance and handing me this glass today. Very, very happy to have that. I offer you a virtual cheers. Celebrate that we're able to get together tonight to continue to learn about and support the research happening at the School of Science. A few housekeeping items before we start here. Everyone's been muted by the host, so please use chat for any questions. You should be able to see the chat tool, chat button, maybe at the bottom or the right side of your Zoom window. If you're in full screen, you can hit the escape button to minimize the screen for easier access to the chat. And we'll do our best to make sure all questions are answered after the presentation is over. I especially would like to thank School of Science Interim Dean Shiaofen Fang for joining us this evening. And I'd like to invite you, Shiaofen, to say a few words.
All right. Okay, I think I'm unmuted now. Great. Thank you very much. It's great to see the return of the Science on Tap in the virtual space. So I hope all of you will enjoy the evening as much as you will do in your physical space. I also want to take this opportunity to give you a quick update about school. We haven't met for a while, so a lot of things has happened, obviously. So this year, the IUPUI School of Science has done very well. We have graduated 659 recipients of bachelor degrees. This is a record, as the marks the most we ever had. We also graduated 135 master degree students and 42 Ph.D. degree students, for a total of 834 graduates. The vast majority of the graduates, of course, will stay in Indiana and contribute to the state's economy. That's a remarkable positive impact on the Indiana's economy and the quality of life. Although, as you all know, we were not able to celebrate with our students the graduations in a formal commencement this year with the pandemic, of course. Our online graduation ceremony videos and social media messages have received very positive feedback from students and their families. And we are incredibly proud of the achievement of our students and of course the great job our faculty and staff have done in educating our students. So talking about achievements, so this year science took 38 spots on the IUPUI's top 100 undergraduate student list, more than any other schools on campus as usual. We also have 6 of the top 10 students, and the top student is also a science major. I think it's a biology major. Again, our graduate students also have done very well this year. So science has 13 of the IUPUI Elite 50 graduate students. Again, that's more than any other schools on campus. So congratulations to all our students and faculty and staff. Under the current circumstance with the pandemic, I think our faculty and staff really have done an excellent job in transitioning to online teaching during spring and the summer terms. As you may have heard, of course, teaching in fall semester and the next spring semester will be in a hybrid mode. So some classes will continue to be taught online, but other classes will be taught in classrooms on campus. So obviously this leads to a tremendous planning and complications in terms of classrooms, assignments, scheduling, maintaining social distance in classrooms, how do you do testing, what about safety issues, etc. obviously. So I really want to thank everybody involved in this process for the hard work and patience during the planning process. Okay. A staged return to campus plan has been announced last week, I think. According to this plan, student, faculty, and staff will be allowed to back to campus starting on August 1st, with, of course, a set of safety measures and rules, such as masks and social distancing. The school will start to open all our student-facing services and offices on August 1st. So this includes all the department offices and also the dean's office. People might be rotating a little bit in order to keep a social distance, but we will try to keep all the offices open. Research has already started. The reopening has started on June 1st. So many labs have already been in process of coming back to campus for regular research activities for faculty, staff, and graduate students. So undergraduate students are not allowed on campus yet during the summer, but they will be on campus in fall semester. So finances with the school will be a major challenge next year. So we do expect significant financial shortfalls in the next fiscal year. Of course, because of the state budget cut, we just heard today that we'll have a 7% budget cut for our state appropriation, and anticipated enrollment drops at all levels. So we are actually doing pretty well with the enrollment in the summer. Summer enrollment has been actually up by almost 25%. So that's amazing. But fall enrollment is more challenging. We expect a drop about 3 to 5% in the fall. So that's going to impact our budget and everything else. Well, finally, I just want to take this opportunity to express the big concerns about the big national issues. So my deep concerns about the recent events related to the police brutality and racial injustice. As a school, I just want to say that we strongly condemn the violence against the Black community as well as all forms of racial discrimination and injustice. I want to assure the School of Science community that we are committed to building an inclusive and welcoming environment for our student, faculty, staff, and visitors of all backgrounds and experience. So finally, I want to thank you all for attending this virtual Science on Tap. I hope you will enjoy tonight's talk. Thank you.
Thank you, Dr. Fang. It's now my pleasure to introduce Stephanie Andel. Stephanie received her BA in Psychology and Spanish from Bradley University in Peoria, Illinois, and went on to get her Ph.D. in Industrial and Organizational Psychology from the University of South Florida. After 2 years as a postdoctoral scholar in the Mumma College of Business at the University of South Florida, she joined the faculty in psychology at IUPUI in 2019. Stephanie's research focuses on understanding how work influences employee health, safety, and well-being. Stephanie, the Zoom is yours.
Thank you so much, Shawn. Let me see if I can properly share my screen. Okay, can everybody see that? Awesome. Okay. All right. Thank you all so much for being here today. So as Shawn mentioned, my research generally focuses upon understanding the impact of work stressors on health, well-being, and safety of employees. Most of my recent work has focused upon the experiences of healthcare employees in particular, such as EMTs and nurses. So today I'm pleased to present a new study that seeks to understand the experiences of these employees within the context of the COVID pandemic. So first, I'll quickly go over some background on the coronavirus pandemic itself and the impact it is having on healthcare professionals across the country. Next, I'll introduce a recent study that I conducted with my collaborators about healthcare workers' experiences during the pandemic. Specifically, I'll outline some of the key challenges that these employees are encountering during these times. And then I'll wrap up with some recommendations on what can be done to better support these folks. And lastly, I'll be happy to answer any questions that you might have. But before I get started, I want to acknowledge that I could not have done this work without my wonderful collaborators, Archana Tadone of University of Baltimore, Mariana Arvan of UNC Charlotte, and Winnie Shen of York University. Okay, so as I'm confident that you're all well aware, the coronavirus pandemic continues to spread across the world. So as of today, there's been over 8 million recorded cases across the globe, with a quarter of these being recorded in the United States. And tragically, the pandemic has resulted in over 400,000 deaths worldwide, again, with over a quarter of these occurring in the US. So as you might imagine, the pandemic has therefore greatly influenced the work experiences of healthcare professionals across the world and here in the US. So here you can see many of the US headlines documenting the physical and psychological toll that working on the front line of the pandemic is having on these employees. And unfortunately, it has even led to instances of suicide of frontline healthcare employees. Clearly, something needs to be done to help these people, right? But where do we start? Well, in order to answer that question, we need to better understand a few things. First, we need to understand what are these employees' key concerns? What are the main challenges that they're encountering on the job? Second, how are hospital leaders failing to support their employees? And third, what can hospital leaders do to better support their employees? So in order to try to start answering some of these questions, my collaborators and I conducted a longitudinal 2-month study of healthcare professionals across the United States. So this work was funded by the IU Office of the Vice President of Research. The survey launched on May 1st, and the data collection is still ongoing. So today I'll be presenting some initial results. Specifically, we surveyed 116 registered nurses who are working full-time on the pandemic, or full-time on the front lines in direct patient care. So we had 32 states that were represented in this sample. And each survey that nurses completed asked them a variety of questions about workplace stressors that they've encountered related to the coronavirus pandemic. We also had them describe their biggest challenges that they dealt with, and further, they reported what their hospitals were and were not doing to support them during this challenging time. Okay, so upon analyzing both the quantitative and qualitative data, key challenges or concerns that consistently showed up. So specifically, these nurses reported issues related to understaffing, insufficient communication, inadequate safety protocols, and extensive emotional demands. So I'll go through each of these quickly and see what the data said. So the first is understaffing. So as I mentioned, across both the quantitative and the qualitative data, nurses were consistently reporting that their units are understaffed. For instance, over half of our nurses stated that their work unit needed more employees to adequately fulfill their work tasks. And we were actually quite surprised to learn that many hospitals had to cut hours of many nurses at the same time that the pandemic was growing. So this is largely because the freezing of elective surgeries has influenced hospital finances, and this put ICU nurses in a very difficult position. So as you can see in some of these qualitative quotes here, the first individual mentioned, we have frequently been assigned a 3-to-1 ratio, so 3 patients to 1 employee, and the usual ICU ratio is 1-to-1 or 2-to-1 due to budget cuts. And others noted that cutting provider employees or hospitals, were cutting provider and nursing hours while they were continuing to see increases of patients, and another mentioning that they were simply just always understaffed. Oops. And the second key concern that we noted was insufficient communication. And this theme arose in a couple of different ways. So specifically, the vast majority of nurses reported a lack of consistent and effective communication from upper management. That's what we would call insufficient downward communication. And further, nurses reported a lack of support for upward communication. So that is when employees try to speak up about concerns or make suggestions about how things could be improved, they felt that they were consistently shut down and maybe ignored by management. So it's therefore perhaps unsurprising that employees were not confident in the way that their hospital was handling the pandemic. So when we asked participants that, only 33% said they were confident to a large or very large extent. And similarly, when asking about their supervisor's handling of the pandemic, only 38% said that they were confident in their supervisor's handling. These communication concerns are also evident in these quotes from participants. So for instance, you can see concerns about communication from management here. So for instance, One person read in the paper that a nurse at their hospital contracted COVID at work, no word from the employer. So they learned about this through the newspaper and not directly from their employer. Another individual mentioned that their supervisors were not on sites with the rest of us, of course, inhibiting communication. And then another individual noted that policies were consistently changing repeatedly with short notice. And further, as illustrated here, efforts to speak up about concerns were consistently met with silence or disregard. So one individual noted they wrote a long evidence-based proposal to overhaul current unsafe COVID ICU environment, and they received no response at all. Another individual said they were labeled as a disgruntled employee when speaking up for safety, and that they should just deal with the PPE crisis. And another individual mentioned that they felt that when they tried to talk to superiors about COVID, they were basically told, or they were told that they basically signed up for this. The third theme that I'll mention was inadequate safety protocols to protect employees themselves. So for instance, in this chart here, you can see that many employees were concerned about the availability of safety equipment and effective protocols. I thought it was quite interesting that if you look on the right side of the screen here, individuals were less concerned about the availability of resources that are patient-focused, such as ventilators and ICU beds, which of course is a good thing. However, you can see that employees, on the left here, employees were most concerned about the availability of resources to protect their own health, right? Clear safety protocols, COVID tests for staff, and of course, PPE, which we've also heard a lot about in the news. This lack of attention on employee safety is evident in some of these quotes as well. One participant noted that their hospital system made it so that pregnant staff must care for COVID patients, which was a huge stress, a source of stress. This person in particular was going through fertility treatment, so of course this was a major concern for her. Another participant mentioned they were initially told they were not allowed to wear masks because of how it made the hospital look, right? So again, kind of this theme of feeling like they are not the priority here. And so that came out quite a bit in the quotes. And then here's some quotes about PPE specifically, talking about the lack of PPE, requests for them to reuse N95 masks, and describing the gowns that they received as trash bag material, not sufficient to protect them on the job. And the last theme that I'll touch on today is the extensive emotional demands that these individuals have been exposed to throughout the pandemic. So for instance, almost 3/4 of the sample reported that their work was often or always emotionally demanding over the course of this first survey. Further, almost half of them said that their work was often or always put them in the most emotionally disturbing situations. So some of these very severe emotional situations. And we can only imagine, right, how difficult it would be to assist patients who are battling this horrible virus each day. And of course, it's important to note that these emotional demands don't just stop at work, right? So nurses are reporting that the impact of these demands are also spilling over to impact their families as well. So one participant mentioned it's exhausting. They're constantly worrying that they'll get someone else or their family members, they'll get someone else sick or that their family members will get sick. And another individual noted that my family is very worried about my safety, right? Talking about how their family is afraid that they're going to die when working on the front lines. So unsurprisingly, we found these COVID-related work stressors to be correlated with an array of health, safety, and well-being outcomes. So for instance, they were associated with physical outcomes such as sleep quality, psychological health outcomes such as PTSD symptoms, compassion fatigue, emotional exhaustion, safety outcomes such as near accidents, family outcomes, and the list goes on, right? So there's a lot, having a lot of impact on these employees' lives. Clearly, more work needs to be done to support these employees. So what can be done? Well, here are a few suggestions for some ways to start. First, I didn't even make a slide about this, but making sure that employees have adequate PPE is of primary importance, right? We need to protect those who are putting their lives on the line to protect us. But in addition, I have 3 other recommendations from the literature that I want to touch on. First is seeking out employee feedback. Right? Hospital leaders really need to make sure that they support and actively solicit employee feedback. Employees on the front lines are going to be the best resource for learning what's missing and what's not working. They're also going to have excellent ideas about how to improve current protocols in order to make the workplace safer, more efficient, and hopefully less stressful. It's also important to note that providing opportunities for employees to give feedback can empower employees and can boost unit morale, as long, there's a caveat here, as long as leadership actually responds to that feedback, right? You don't just want people to provide feedback and then there be no response, because that has detrimental effects. So we asked participants in our study to also provide information about what their employers were doing to effectively support them. And one person noted that having managers present on the unit more often than usual, continually asking about what they need with or need in terms of supplies was very helpful. Okay, the second recommendation is providing clear, consistent, and regular updates to employees. Right? Consistent communication is key. Now this, of course, ensures that everyone is on the same page so that processes run smoothly and so that everyone is kept as safe as possible. But it's also important to note that communication can impact the workplace in that it also reduces feelings of loneliness and isolation, right? And these times are incredibly challenging for healthcare professionals on the front lines. So by communicating consistently, hopefully they could feel less alone and less in isolation. And as one person noted in our study, having consistent communication regarding updates on the status of the hospital and the plan for the future, they felt was quite supportive. And finally, I've alluded to this a bit in the previous slides, but it's worth mentioning that in addition to supporting employees' physical health through proper safety protocols and equipment availability, I would say that it's imperative that hospitals make a concerted effort to promote employees' psychological health as well. Right, so for instance, research shows that what we call psychological detachment, that is the ability to disconnect from work-related thoughts, is very important for reducing the negative impact of work stressors on psychological health. So employers can help promote employee detachment, this psychological detachment, in a number of different ways. For instance, they could provide consistent and regular work breaks during the day so that employees have some time to kind of regroup after particularly emotional days. It's also possible to promote detachment after work by ensuring that employees maybe aren't contacted after the workday is over. If it's possible to have nurses not on call, right, so they can actually come home and not have to think about work, that can help alleviate some of the negative effects of emotional demands. And other ways to promote psychological health is to acknowledge employees' hard work and effort and the sacrifices that they're making during these times. And then also to limit the excessive emotional demands as much as possible. Now, of course, there's no way to eliminate the emotional demands. This is a very difficult time and who knows how long it's going to last, but doing what organizations can to reduce the emotional demands or kind of to spread out the burden as much as possible would be helpful. So one person noted, my unit allows us to take a break from the COVID unit and swap for a shift with a regular medical unit, right? So this is a nice example of providing ways to try to kind of reduce the emotional demands or allow individuals to have some time, again, to regroup in the midst of these emotional demands. All right, so in summary, we all, including hospital leaders, continuously say that healthcare workers are heroes, and they truly are. But the data suggests that they might not be, they're not being treated as such, right? It's important that they have the resources. They're frequently missing a number of key resources that are important for supporting both their physical and psychological health during this time. So the goal of this study is really to just highlight some of the key challenges faced by healthcare workers during this pandemic. And ultimately, it's our hope that this study will help inform hospital decision makers and policymakers once the crisis is over to make the work environment safer, healthier, and better prepared for years to come. So thank you so much, and I'm happy to take any questions. Oh, and I will stop sharing my screen here if I can figure out how to do that.
I'm going to risk not typing my question. I was interested if you, it looked like you had a quote or two there from people who were in the less stressed group, or at least experiencing things at work that were reducing their stress. I'm curious if there was any lesson to be gleaned from kind of the positive side of the nurses. So, you know, if 70% of the nurses are concerned, 30% of them weren't. What wasn't going on for those 30%, right? That was positive.
Yeah.
Good.
Absolutely. So that's a great point, right? Not everybody is in terrible shape. And that's a lot of that, I think, comes from some of these hospitals, right? So these nurses came from all over the country. And so some of the hospitals were clearly doing a good job, right? They were doing, those were where those quotes came from, you know, providing consistent communication, soliciting feedback. A lot of folks mentioned, you know, their supervisors were there on the floor with them, and they felt that having that instrumental and not just emotional support was really helpful and provided them with more support. And then we are seeing that in some of the outcomes, right? When we look at some of the, for instance, post-traumatic stress symptoms, sleep quality, there's a difference there. Having that support really makes a difference.
I have more, but I'll let someone
Yeah.
I'm also not going to type, because as soon as I tried to type, it hid the entire screen. So I'm not going to try that again. So just building off of that question, was there data gathered about the employers, such as regional data about the community that the nurses were working in, and how might that play into the positive and or negative feelings? The, you know, good management, is that just something that happens everywhere, or is there some sort of a formula like good state funding or you know, support in the region for certain things? Just anything.
Yeah, that is a great question. I have not analyzed that data, but I am so excited to dig into some of these specific questions, right? So we do have recorded information about, for instance, the states that individuals are working in, practicing in, information about the hospitals themselves and kind of what resources are available. So we'll be able to really bring in those layers to get a better understanding of kind of how the context is influencing these outcomes. So that is a great question, and I'm looking forward to looking into that.
Okay, I'll jump back in. Was there any baseline data for these groups? I mean, I think of ERs and ICUs as pretty stressful, intensive things in the best of times, right? It clearly would be worse, you would think, but I'm just curious if there's any sort of comparison, baseline comparison ability here.
Yeah, so we don't have baseline data from that we collected ourselves. There is quite a literature on, as you're saying, all of the workplace stressors within healthcare and kind of in normal times, right? And I would argue that this is really just kind of all of that intensified with the pandemic. I am in talks with a group at a University of British Columbia, UBC, and we were talking about doing some kind of benchmarking, because they actually do have data from before the pandemic, and they're going to start using some of the same scales and variables that we included, so that we'll be able to do some of that benchmarking, because I do think that's really important to really understand kind of how different it is now versus before.
Steph, is there any way to, first of all, great talk, by the way, and it's so timely and important, but I'm wondering if there's any way to connect some of your findings to actual health-related outcomes for patients. You know, obviously, if people are suffering as caregivers, then patient care goes down, and I can just imagine that that exacerbates healthcare disparities and things like that. So I didn't know if you have any access to that in your data collection efforts, or if that's something that you could do, that you know about and could speak about a little bit.
Yeah, so there is a literature out there, and there are some connections made to patient outcomes. And as you would expect, you know, when healthcare professionals are, you know, not feeling the best, then that of course influences patient outcomes. We didn't include patient outcomes in this specific study, but that is something that, you know, it's so important, and it'd be something I would love to do in future.
Okay, this is my last one, and
Yeah,
fully
of course.
So I was interested in, did anything emerge or any ideas emerge about what people in the community can do to help? You know, your focus obviously was on what hospital management and so forth could do, but did anything emerge, even incidentally, around that?
Yeah, you know, I'm trying to think through some of the qualitative data. I don't think so. So the biggest thing that comes to mind, which doesn't address your question, but a lot of folks were saying, you know, we constantly are being told that we're heroes. We don't want to be heroes. We don't want to be putting our lives on the line. You know, we want to help people, but they just felt like it was this idea that they constantly were heard that they were being heroes, but then at the same time not being provided the resources that they felt that they needed. There was kind of, that came up a lot, but nothing off the top of my head I can think of that focus specifically on community members. That would be very interesting. So we have another question. Let's see. Do you think, this is from Kristen, do you think that long-term, the stressors from this pandemic are going to deter future students from choosing this career path? Or potentially, do you think because of this pandemic, more people will feel more of a calling to take care of others? It's a very interesting question. I think I could see it both ways. And so I do some work on callings, or kind of a workplace meaningfulness, right? And so understanding how feeling called to a specific job or feeling really identified with a job influences stress process. I would think that I'm imagining, if I had to guess, people who really identify with the idea of being in healthcare, being in nursing, those folks might be more inclined, I think, to kind of join the front lines and participate, and right, because seems like there might be more of a chance to really make a difference. But that, I did not collect data on that. But that's a really interesting question. It'll be interesting to see what happens in the future.
I would imagine, wouldn't it be interesting to see a follow-up study, you know, 2 years from now, to see what attitudes have changed and what trends you might see
Absolutely.
coming out of something like that. Specifically, I'm thinking about funding, because the left side of that chart, the more negative side of that chart, seems so skewed toward they're not providing us with these supplies. We have plenty of supplies for the I mean, let's go to, from an economic point of view, for the customer, but not much for the provider, for the caregiver.
Sure.
It's pretty interesting to me. I'd love to see what it's like 2 years from now.
Yeah, me too. And there's another question, were there any specific reasons for not including doctors in the study? That's a great question. You know, we just decided to focus first on nurses, since they spend a lot of time directly with patients, right? I mean, of course, doctors do as well, but nurses are providing a lot of that, like spending more time of the day with patients. So we wanted to understand their experiences. But certainly doctors EMTs, paramedics, all of these folks are really experiencing an array of really unique stressors during this time. And Amanda asked, she's wondering if I could talk a little bit about how I'm structuring my research longitudinally. Are you collecting the same variables and looking at changes over time, or possibly looking at external variables such as changing in funding, legislation, and how they impact healthcare outcomes? My answer is both. So for the longitudinal data collection, for the actual scales and scales that are included in the survey, I included everything at the same time so that I could actually do exactly what you're saying and to understand, looking at the change and seeing kind of how these trajectories and, for instance, health outcomes change over time. And then in addition, I would love to look at some of these external variables. Like I was mentioning, we have the location data, so I'll be able to map some of that on, for instance, looking at state-specific policies, mandates, how that's influencing these things, state funding. And then we'll also really be able to look at things like virus spread in those areas and other variables that are not included in the data set that we will be able to bring in.
Do we have any other questions for Stephanie? Okay, well, thank you, Stephanie. Thank you all for joining us tonight. Science on Tap is a great way to learn about what our faculty and staff are doing. Great studies on timely issues. I personally love our Science on Tap events. We're planning to continue these presentations into the fall. I really like this Zoom layout. It seems to be pretty effective. Steph, did you feel like this was a good layout? You're the very first, so.
Yeah, it worked out well. Thanks all for bearing with me, and it was really great. Great experience.
Great. Well, keep an eye out for more information. Check your email, check our newsletter, and we'll let you know when the next event is. With that, I will bid you all good night and take care and be safe.
Thank you, everyone.